Hello everyone, welcome back to my channel, The Theoretical Doctor Audio Blogs. In this video, I will be sharing my experience working in the labor ward as a house officer in the O&G Department. The link to the article of this audio blog is available in the description below if you would prefer to read on it instead. Otherwise, let's begin. The labor ward. When I first entered this posting during my tagging period, I was allocated to work in the labor ward. This is the place where taggers would be allocated initially before being shifted into other wards such as maternity and gynae. The labor ward is an extremely intense place, yet also the best place to learn upon first entering this posting. Firstly, because the whole on-call team will be there, which are the on-call medical officers, registrars, and also specialists. Hence, it is not as daunting as it seems. You are never alone, and help is always within reach. The labor ward in Sarawak General Hospital is located on level 4 of the main building situated opposite the nursery. Upon entering the labor ward is the Pregnancy Assessment Center, PAC, followed by the rooms at the back where patients in active phase of labor or patients who are being augmented are situated. On normal days, there would be one house officer allocated to PAC and one house officer allocated at the back. On good days when there is more manpower, the work is not as tiring. However, on bad days, when the manpower is anemic, only one house officer would be in charge of the PAC and the labor ward. The first one, PAC, Pregnancy Assessment Center. When patients first present to the hospital, 90% of the time, they are directed straight to PAC, where the patients will be clocked and assessed based on their presenting complaints. Some may come due to contraction pain, which is most common, bloody show or bleeding or leaking liquor, which means their water broke, miscarriages, nausea and vomiting in pregnancy, elective admissions for cesarean sections or induction of labor, reduced fetal movement, menorrhagia, etc. The PAC or labor ward serves as the emergency unit solely catering to antenatal mothers or gynecological issues, unless of course the patient is too unstable to be transferred to PAC from the main emergency department. The patients presented to PAC are usually attended based on the severity of their presenting issue and not according to order. As a house officer, we will usually clerk the patient as well as perform their physical examinations before performing necessary tests such as vaginal examination for term mothers presenting with contraction pain or speculum for patients presenting with leaking liquor, followed by collecting the HVS-CNS, which is high vaginal swab, culture and sensitivity, and coming up with our own impression, the diagnosis, followed by a plan before presenting it to any medical officers, whereby our reviews will be counter-checked or rewritten if necessary. From the PAC, the patients will either be admitted to maternity ward for observation or gynae or labor ward if they are in active phase of labor, or straight away posted to OT if necessary, or even sometimes discharged. On days where the PAC is burning, we would not have time to sit and properly clerk the patient. Hence, as a house officer, we will be asked to take bloods or post case or fill forms, set branula, or to send bloods. The second part, labor ward. Once you understand the flow of work in the labor ward, it's pretty repetitive for almost all the patients. Most of the time, when a patient is brought to the labor ward, it is for augmentation of labor. The moment the mother is brought into the room, as a house officer, it is our duty to do a transfer-in review, set a branula if it is not set, check for their full blood count results, and any GSH, which is group save and hold if it's available. Once that is done, we will do a vaginal examination to check the opening of the os and also artificially rupture the membrane of the patient with an amnio hook. From there, we will assess the color of the liquor and the patient is put on continuous cardiotocograph monitoring till delivery. Of course, there are instances whereby the mother delivers upon being transferred to labor ward. The spontaneous vertex delivery is usually conducted by the midwives. As house officers, we are able to conduct as well under the supervision of midwives. However, our main duty is to continuously monitor the CTG and inform if there is any decelerations or abnormalities, as well as to prepare for emergency cesarean section or vacuum-assisted delivery if needed. All in all, the labor ward can be a relatively fun place to work. Personally, I've enjoyed my time working in the labor ward, especially when the nice team is on call. Thank you for listening to this audio blog. Do stay tuned for more, which will be available every Wednesdays, Thursdays, and Fridays. Remember to click on the subscribe button as well as the bell button so you won't miss out on any upcoming audio blogs.